My name's Dr. James Weiner. I'm director of the Weiner Wellness Center, WINER Wellness Center, located in Pittsburgh, Pennsylvania, 2419 Baldwick Road, Pittsburgh 15205. Our phone number is 412-922-WELL or 412-922-9355. Our website is drweiner.com, drwiner.com. We have two Facebook pages, one at James Weiner and one at Weiner Wellness Center. How many people are on Facebook? How many of you have friended us on Facebook? All right, now you can friend us on Facebook, and there's two advantages to that. Number one, you'll get notified when we or anyone else posts something. Number two, you'll be able to post stuff. I saw where I put something about charities, most of the money going to the executives or the solicitors that get paid to call you, and very little going to actual people in need. And so several other people have posted articles that actually support that and also talk about other charities other than the ones I listed. So what I would say is join us on Facebook. Although it's a smaller crowd than Dr. Honigman. Dr. Honigman graduated valedictorian from Chiropractic College. I graduated Chiropractic College valedictorian, so we have something in common. All right, so a few of you are here for the first time. Let's lay out the ground rules. What we do here is different than the medical community. The medical community is basically treating the symptoms of bad diet with drugs. I'm not the only one saying that. Dr. Esselstyn, maybe Dr. Honigman mentioned that in his speech. Dr. Esselstyn from the esteemed Cleveland Clinic is reversing clogged arteries through a vegetarian diet. He says that right in the first chapter of his book, Prevent and Reverse Heart Disease, which we have here. Today we're talking about pain. Pain, go away. Now we used to call our clinic the Pain Release Clinic when we were in the South Side. And I changed the name when we bought this building because that kind of limited the focus in people's minds. We were always helping people with cancer and irritable bowel syndrome and acne and psoriasis and all these things. And those things don't necessarily involve pain. So I thought we'd better call it the Weiner Wellness Center because what we're really about is getting well and staying well. Well, I'll be 69 in a couple months. I don't have any pain. Now, I have a little bit of arthritis. I'll tell you why. Because when I was a teenager, I fell off a high bar in gym class. And I don't have any back pain, but I do have a little arthritis there. And also I had orthodonture where they moved the teeth in the wrong place. They created what's called a TMJ problem, temporomandibular joint problem. And when I move my jaws, I can hear a little creakiness in there, but I don't have any pain. So I want you to know that a lot of people have pain, even though they have arthritis, the pain may not be coming from the arthritis, okay? How many people here have pain? Let's see a show of hands. How many people have arthritis? Okay. So they're not synonymous. The doctors may get into a presumptive mode that the pain is from arthritis. So basically there's a big difference between what we do here at the Weiner Wellness Center and what they're going to do in conventional hospital settings or conventional medical doctor setting. Number one, we're going to look for the underlying causes of your symptoms. Okay, so it's not just a matter of putting a label on a symptom, because you can have the same symptom for completely different reasons, and we'll get into that a little bit when we talk about inflammatory arthritis. So they might say you have lupus or you have rheumatoid arthritis, but maybe the next person that has that diagnosis has it for a completely different reason. So they have the same symptoms, but actually they have a different disease. And we look for the underlying causes. Americans are only 4% of the world's human population, yet as a nation we're consuming 75% of the world's manufactured drugs. So this is the great oasis for the big pharmaceutical companies. And also, since there's no limitation on what you can charge for a drug, what they can charge for a drug, the drugs that you buy in the United States are hundreds of times more expensive than the same exact drugs you might buy in other parts of the world. The medical doctor's education is largely controlled and funded by drug companies. Up to 90% of the operating budget of medical schools is funded by drug companies. The media. Big Pharma spends $8 billion a year, $8 billion a year on ads on television. So you're probably not going to hear very much about natural health on television because they've got their marching orders from their biggest advertiser. So where are you going to go for information outside the medical box? Well, you can come here into the Weiner Wellness Center. We have all this free literature. Most of it's been posted on our website at drweiner.com. We have something like 60 videos on nutritionalfrontiers.com. We have many on youtube.com. So we are not hiding this information. I know that's a false criticism I got from some very young medical doctors. They said, I'm hiding the information. Well, wait a minute, I'm on radio 35 hours a week. We have the nutritionalfrontiers.com website. We have the drweiner.com website. We have all kinds of videos posted on YouTube. We're doing anything but that. We do seminars all over the country trying to educate people and their doctors about health. So the thing is that pain is a big motivator. I had a guy in here the other day. It was very interesting. He came in for arm and leg swelling about a month ago. He came in the other day. He was in excruciating pain. He had his head down. He had to have his son drive him over. He couldn't even drive the car. And he said, I can't even talk. He said, I get these terrible headaches. I've been getting them since I was a child. Now the guy's in his 60s. And he says they're cluster headaches, meaning they come every few months or every 6 months. They come in time clusters. So it has nothing to do with the geographic location of the headaches. It has to do with the chronology that he'll be fine for a few months, then he has headaches, excruciating headaches for 3, 4, 5 days or a week or whatever. I said, do you mind if I touch you? He said, no. I said, have any other doctors helped you? He says, well, I start taking drugs, and he was on a drug that now was causing his hands and legs to re-swell. We had gotten rid of most of the swelling, and then he went back on this drug, and it started causing swelling again. I showed him right in a book that that particular drug causes swelling. So I started working on muscles on his neck. Plus I did an adjustment to one of the bones in his neck, and guess what? About 15 minutes later, he was totally pain-free. And his son was in shock. The son, who I guess is probably in his late 20s or 30s, said, I've never known my dad free of this pain, and whenever he'd have this pain, no doctor helped him. And I asked the patient, he says, that's right. I'd go in their office, and even their drugs and shots didn't get rid of the pain. I got rid of it in a matter of 15 minutes with the trigger point muscle therapy and the spinal adjustment. So we've given you this article, and if you don't have it, we have more up here, called Natural Approaches for Pain and Arthritis. Everyone have that, or a few people didn't get that yet? So this summarizes a few of the things we're going to talk about. Now, I did not pass out, but we have information on the hazards of medications. There are two types of medications for pain. One is called the steroidal medications like prednisone and cortisone, and they cause all kinds of problems like bone loss, weight gain, fungal infections throughout the body, decreased immunity, fluid retention, and even cancer. And if you're having injections, it will probably destroy the area where you're injected, like the cartilage and the bone around a joint. Now, if you've been on prednisone or cortisone for more than a week or so, you cannot just stop cold turkey. I'm going to make that warning. Let's say you're on non-steroidal anti-inflammatories. Most of them will cause damage to your digestive tract, your esophagus, your stomach, your small and large intestine, including ulceration and bleeding. I might mention that prednisone and cortisone also can cause bleeding. I've had patients that died from taking that because they had so much internal bleeding. The non-steroidal anti-inflammatories also can create heart attacks and strokes. Maybe you remember the name Vioxx. This was supposedly a breakthrough some years ago, what they call the COX-2 inhibitor enzyme. was supposed to inhibit the pain enzyme COX2, and they found it killed over 150,000 people, and tens of thousands of others were permanently injured. In fact, Merck, the manufacturer, settled for about $4 billion out of court. However, Celebrex, which is a very similar product, is still on the market. Anyone here on Celebrex? Okay. Now, other over-the-counter medications even are dangerous. You might presume, because some 6-year-old can walk into a drugstore and buy Tylenol, that it's safe. Tylenol, among many other things, interferes with liver detoxification. It can be so dangerous that if you take a Tylenol within a few hours before or after drinking a glass of wine, the wine can kill you, let alone what it does when you're taking other medications. We had Dr. Fitzgerald speaking here last week about his daughter who is autistic, and he said his research finds, among other things, that a lot of children are given Tylenol for circumcision and for pain when they're going to have these injections. Sometimes they have 5 and 6 different vaccines given them the same time. The Tylenol shuts down their ability to detoxify all the toxins in the vaccines, like the mercury, formaldehyde, antifreeze, nail polish remover, etc. And that may be a major factor in causing the 4 A's, what I call the 4 A's, that kids get from vaccines. Arthritis, yes, children are getting arthritis, asthma, allergies, and autism. Anyone taking any painkillers here? See a show of hands. Painkillers? Suddenly no one's taking painkillers. Okay.
Dr. Weiner, I just wanted to tell you that my friend had been drinking and he took Tylenol. He died.
There. Well, Kathy's saying that she had a friend who drank some alcohol, took Tylenol, and he died. So it's a very common thing. So Tylenol is a very dangerous drug, acetaminophen. All right. And we have articles over there by the food on the metal spindle literature rack about ibuprofen and those hazards. I didn't pass that out, but we have other free literature. All right, so let's say you do have pain and you do have inflammation. What's a safe way to try to manage that? Well, we have a product called X-Flame. And we've passed out this. Hopefully everyone has one of these. Did you get one of these? You didn't. If you look at number 7, this is the final talk of the week, the 7th lecture I'm giving. And you'll see we have X-Flame. We also have a product called Inflame. The main difference is a patented ingredient called creselazine. Now, the one warning we have to say about creselazine, it may thin the blood a little bit. So if you're on blood thinners like Coumadin, Pradaxa, Xarelto, or high-dose aspirin, then I would recommend the Inflame. Other than that, X-Flame should be totally safe to take. You can take like 1 capsule 5 times a day. So it's a natural anti-inflammatory that will not cause any of the side effects that I mentioned a minute ago. But we have to get to the cause of the pain. We need to talk about causation of pain. So yes, we have natural things like X-Flame and Inflame that will help reduce pain. But why not figure out what's causing the pain? Now, I said a few minutes ago that you can have pain that's not coming from arthritis, even though you have arthritis. And in that article you got on pain, it talks about trigger point muscle therapy. That's what I did on this guy that had the cluster headaches. We had 2 people in a few weeks ago that had frozen shoulder, limited range of motion of their shoulder, and we corrected it through the muscle therapy. This is something that most conventional orthopedic doctors, most conventional primary care physicians, and even many physical therapists know nothing about. That you can have tight muscles that cause pain referral and limited range of motion. There's a 2-volume textbook called Myofascial Pain and Dysfunction, the Trigger Point Manual, written by Dr. Janet Travell, MD. She was President Kennedy's White House physician, and she helped to map out the common pain referral patterns. I'll give you a few that would really mystify doctors. How about pain in the teeth? You go to a dentist, the dentist does x-rays, says there's nothing wrong with your teeth. The pain may be coming from tight muscles on the side of your head. I had a guy in here the other day said he had trigeminal neuralgia, pain into his face. That can come from a tight muscle called the sternocleidomastoid muscle that runs from the back of your ear along the side of your neck. How about pain behind the eye like this guy had the other day? That's usually the upper trapezius on the same side. If the pain's on the left side, you feel pain in the eye or behind the eye, it could be this muscle right up here that's tight. How about back pain that goes across the low back? It may be coming from your abdominal muscles in the front. I had a guy in here who had sciatic pain. He was worried because years ago he had a disc operation. Those are the wedges between the vertebrae. And now he was having recurrence, but in questioning him, I found he didn't have pain in his low back. It started in the middle of his buttock and then went down his leg. And I explained that was coming from a tight muscle in his buttock squeezing the sciatic nerve. So he wasn't having impingement of the sciatic nerve up here, where it starts. He was having it here. So it's a tight muscle, so it had nothing to do with his disc or his vertebra. So you can have groin pain. And that can be coming from muscles on the side of the abdomen. You get a pain across the upper chest. I had a lady in here years ago. She had open heart surgery, and she had pain across the chest. And she had pain across the upper back, and it was coming from the muscles that were injured in the chest when she had the operation. So these are very interesting things. How about carpal tunnel? You know, carpal tunnel is usually not carpal tunnel. That probably sounds like something that Yogi Berra would say. Well, what we know is carpal tunnel is the most commonly performed surgery in the United States. People that have tingling numbness in the first three fingers, the thumb, the index finger, and middle finger. It fails 95% of the time. Now, why would doctors do this surgery when they know they only have, you know, a 1 out of 20 chance of helping people? Because they get paid for it. We have the fee-for-service system in the United States where people get paid for doing operations and procedures even if they don't work. How about chemotherapy that fails 97% of the time? They do it on almost all cancer patients, even though most of the time it's useless and counterproductive. In England, they almost never perform carpal tunnel surgery. You know why? The doctors are on salary. They know it fails most of the time, so they're not going to do it because why should they burden themselves with doing more work? They're not going to make more money out of it. So what we have found is that most people that have the symptoms of carpal tunnel really do not have carpal tunnel. Carpal means wrist. And they're talking about the nerve being entrapped in the wrist, and usually that's coming from places other than the wrist. It's not really coming from entrapment of the wrist. The tingling and numbness is coming from misaligned vertebrae in the neck, tight muscles in the throat where the nerves come out, or anywhere along the arm or forearm. And we work on that, never touch the wrist, get rid of it. Now, in 5%, the surgery works, which means that 5% of the time, the wrist is involved. You have 8 little bones in your wrist. And we find that we can adjust those bones. It takes a matter of a few seconds, and that takes the pressure off the nerve. So 95% of the time, the tingling and numbness in the hand is actually coming from misaligned vertebrae in the neck, where the nerves come out, the throat, where they come through, tight muscles in the chest, upper arm, forearm. And 5% of the time, we have to adjust the wrist. So we have virtually 100% success rate with so-called carpal tunnel without surgery because we're addressing the causes. We're not assuming it's coming from the carpal area because most of the time it's not really carpal tunnel. So you can have those symptoms and it's not coming from the wrist, it's coming from the neck or throat or whatever. Okay, so that's the trigger point muscle therapy that we do here. A lot of people have gone to conventional chiropractors and they say that they didn't get much relief or the bones keep going out of place. It's because they have tight muscles and a lot of doctors, including chiropractors, are not addressing that. All right, now, of course, sometimes it can be from misaligned bones, but you have to understand a lot of the nerves don't have any pain fibers. So we find people that have urinary bladder incontinence and they're put on ditropan or Detrol, guys with erectile dysfunction, people with irregular heartbeat, high blood pressure, low blood pressure, There's all kinds of symptoms that may be caused by pressure on the nerves because you do have misaligned vertebrae, but you don't have any pain because the nerves that are being impinged are motor nerves that control the functioning of your organ, your heart, your genitals, your urinary tract, but you may not have any pain. You know, a lot of people say, oh, I don't need to go to a chiropractor, I don't have any pain. Well, maybe you do, because maybe you have dysfunction, like you cough or sneeze and you pee in your pants. You have a regular heartbeat, high blood pressure, whatever. So it could be from nerves being impinged, and because these motor nerves do not have pain-sensitive fibers, you wouldn't know it's out of place. That happened to me once. I was at a conference in Florida, and I felt very nauseous and dizzy, and I thought it was from mold in the air conditioning in my hotel room. But when I got to the conference, I found a chiropractor I knew, and he adjusted my neck and got rid of it. It was actually coming from my neck, but I didn't have any neck pain. Okay. Now let's talk about biochemical reasons why you might have pain. I had a friend who every time he ate yogurt, he would get sciatic pain running down his fine leg into his foot. What was going on there? Any ideas? Anyone got an idea what was going on there? It was causing muscle contraction. I mentioned before that this other guy had muscle contraction in his rear end, and that was squeezing the sciatic nerve, causing sciatic pain. Well, that was mechanical, but it can be secondary to food allergies. You can eat foods that maybe cause muscle contraction, and then you get pain. Also, inflammation. When we talk about inflammatory conditions like rheumatoid arthritis, scleroderma, systemic lupus, and even things like irritable bowel syndrome, colitis, Crohn's disease, asthma, very often these involve food allergies. So we gave you an article on food allergies. It's a two-sided article on food allergies. Of course, most of this is on our website at drweiner.com, or you can call our office at 412-922-WELL or 412-922-9355 and get this information. Did you get this?
I have that one.
You do have this one? Okay. And then we gave you a two-sided sheet on symptoms of food allergies. Where there's a front, there's a back. So we actually have two different enumerations of lists of various symptoms, and you'll see musculoskeletal, arthritis, joint pain, muscle cramps, muscle spasms, muscle weakness on the one side, and then it's listed over here. It's kind of more in a paragraph form.
I didn't get either one of those. Go ahead. Thank you.
So in my experience of 45 years, I've found most people that have inflammatory conditions like irritable bowel syndrome, colitis, Crohn's disease, maybe even migraine headaches, certainly rheumatoid arthritis, lupus, etc., they have food sensitivities or food allergies. And as you'll see on those lists, there's hundreds of possible symptoms, but inflammation can be one of them. And medical doctors will say, well, we got to do some blood work, and maybe they test your ANA or your SED rate or C-reactive protein. Maybe you've heard some of these names. What they're unknowingly testing is very often the reaction of food allergies. So if you have an increased SED rate, they're going to try to put you on prednisone or cortisone, etc. They're going to tell you one of various diseases, but that's just a label. It's not telling you what's causing the inflammation. I can tell you that very often it's from foods. We have a book called Grain Brain, written by Dr. Perlmutter, an MD neurosurgeon, neurologist. Grain Brain. He's talking about how foods, especially grains like wheat, can affect brain function. In fact, the article I've handed out summarizes some of the work of Dr. William Philpott, who was a psychiatrist. We used to have him speak at our health expos years ago. And he talks about how people can have psychological problems, even psychoses, from foods or chemicals that they're allergic to. So certainly you can get inflammation. Now let me explain something. Medical doctors generally do not look for causes. They treat symptoms. I think you heard me say that a few minutes ago. So what happens when they come up with a diagnosis? What they're doing, they're putting a disease label on a cluster of symptoms. But they're not looking to see why you have these symptoms. So they think everyone that has rheumatoid arthritis has the same disease. No, they have the same symptoms, swollen joints and pain, that type of thing. Irritable bowel syndrome, colitis, Crohn's disease. Well, people have diarrhea, gas, bloating, pain. They're not figuring out why. And so the presumption is that everyone has it for the same reason, or at least they're going to treat it the same symptomatically with drugs. And the explanation they'll give is autoimmune disease. How many people have heard that term, autoimmune disease? This is the catch-all explanation because they don't understand what's really causing it. Your body does not suddenly start attacking itself. There is no such thing as an autoimmune disease. You may have stimulation of your immune system, but what's stimulating the immune system? It's not some freak thing where suddenly your immune system went haywire. And how do they treat this? They decide to suppress the immune system. Say they figure the body's always doing the wrong thing. Let's take fever. If you have a fever, they want to lower the fever. Wrong. What you ought to do is increase the fever. If you're sick, pile on more blankets, wear some warm clothing, turn up the heat, because the fever is the body's mechanism for killing off bacteria, viruses, and cancer. When you have inflammation, that's the body's attempt to get rid of these substances that are irritating the body. So we don't want to interfere or suppress the immune system. We want to try to figure out why it's activated. So, you can take Sambucol elderberry syrup, vitamin C, Immunomax, these things that help your body fight disease, and then eventually you won't have the fever. When you have inflammation in the joints, we need to figure out why, and very often it's food sensitivity. So we have a method of testing people to figure out if they have food sensitivities. It does not involve blood work, because we've found blood work for food allergies is very inaccurate. It's less than 50% accurate. I've had people that have those tests and they say, well, I don't know, I eat these foods and I don't seem to get sick. No, there's these other foods that it says I'm okay with, and those things cause problems. So those tests are not accurate. We do what's called applied kinesiology muscle testing. And even better than that, we have a method of improving or correcting your body's ability to handle those foods, chemicals, environmental assailants like mold, dust, grass, trees, ragweed, pollen, or even medications. A lot of people will find they have side effects to medications. They get off the medications, they still have the side effects. Has that happened to anyone here? No, but it's a very common thing. And people wonder, and the doctors wonder, why are they still having the side effects? They're not taking the medication anymore because the drugs are artificial substances that your body was not designed to handle, and your body may not be able to get rid of it. So we have a treatment that can help your body get rid of these substances, whether it's natural things that you're having trouble with, like dust, pollen, cats, dogs, whatever, or if it's medications, or if it's foods. So if you have any kind of inflammation, you should come in here so we can test you and figure out what's causing your inflammation. In the meantime, you can use the X-Flame or the Inflame, like I said. Now, what if you have bone on bone? Anyone here have bone on bone? I love this phrase because it's ridiculous. Here's the thing. If you had bone on bone in your knees, you wouldn't be able to walk. You might have reduced cartilage, that's the covering on the ends of the bones. Maybe some people have had disc problems where their discs shrink. There's cushions between the vertebrae that I mentioned earlier. But here's the thing. The medical doctors have a completely different paradigm or concept of the body than I do. Their concept is that it's an inanimate object. I noticed over here, we had this rough ceramic pot with clover, and someone kept moving it, and this whole table is scratched now. Okay? Now, if you scratch yourself, like if a cat scratches you, or you get a bramble, or you rub against something sharp, you cut yourself, it's going to heal. That scratch on that table is not going to heal. I'm going to have to bring in sandpaper, and then I'm going to have to stain it to try to match the stain, and then I'm going to have to put something like polyurethane on it, right? Because it's an inanimate object, it's not going to heal. How about if you fall and break a bone? Like years ago, I fell in the ice and broke my wrist. It healed. I had someone throw a rock at my car, and they broke the windshield. It didn't heal. Some years later, a few years ago, someone threw a rock and hit my fender and dented the fender. It didn't heal. Why? Because it's dead. But you're alive. And so you can heal. And in fact, you don't have the same body that you had 10 years ago. I mean, you look in the mirror and say, gee, I don't look as young as 10 years ago. You know why? Because it's not the same body. Every cell in your body is replaced within 7 years. You have a new bloodstream every 3 to 4 months. You have new bones every 4 to 7 years. You have new intestines every week. What is happening is while you're alive, and I think most of us here are, you're constantly replacing the cells of your body. Now, what are you replacing them with? We need to talk about the 3 little pigs. Anyone remember that story about the 3 little pigs? You may have learned that in grade school or kindergarten. Okay, there once were 3 little pigs. Now, they were pretty unusual because even though they just had hooves, somehow they could build houses. And the one built his house out of straw, the next one built it out of mud, and the third one built it out of brick. And then this big bad wolf came by, and he huffed and puffed and blew the straw house down. He went over to the mud house and poured water on it, and it dissolved. Then he went to the brick house, and he huffed and puffed and poured water on it, and nothing happened. Why? It was stronger. Why was it stronger? It's made out of better materials. This is your house. You're replacing all these cells every day on a daily basis, replacing millions of cells. What are they made out of? They're made out of what you eat. And if you're like the typical American that eats a lot of fast food and junk food and a lot of refined flour and sugar and soda pop and all this kind of thing, you're not getting the nutrients you need. But even if you're health conscious and you go to the grocery store and you buy a lot of fresh fruits and vegetables, we've lost up to 80% of the nutritional value of our food in the last 50 years because of farming practices. And so the American Medical Association in their journal over 20 years ago said that everyone needs to be on nutritional supplements because it's not in our diet. Either you're eating poorly or even if you're eating well, you're not getting the nutrients you need. I remember when I first planted radishes when I was in my 20s. And when I picked one out of the ground and cleaned it and ate it, it took me back to my childhood because it had all this strong flavor that the radishes 10, 15 years later didn't have. Of course, now it's even worse, okay? In fact, Marcel Proust wrote a book that you would translate in English, In Search of Lost Time, or Remembrances of Things Past. And the whole book starts with him eating this cookie and then remembering his childhood. It took him back to when he used to eat cookies in childhood. Well, that's what happened to me when I started eating organic produce that had some flavor in it. It took me back to the way things tasted when I was a kid. It wasn't that I lost my taste buds, it's the food wasn't raised on good soil anymore and picked before it was ripe, and so it had very little nutrition, very little flavor. So think about a copier machine. If you take an original and you make a copy, it comes out pretty good. But if you take that copy and make a copy, it's not as good. And then you take a copy of the copy, and if you take like the 4th or 5th generation copy, it may be illegible. We have that problem sometimes here. They can't find the originals. They start running off copies of copies, and then you can't even read it. And that's what happens with replication of your cells. When they're changing over, if you don't provide the nutrients you need, each succeeding generation of cells will be weaker, and that's called the aging process. There was a guy in here today, it was very interesting. I was talking to him, and at one point the woman said, gee, you look pretty good, how old are you? And I said, well, I'll be 69 in February. And her husband said, well, I'll be 69 in February. When were you born? I said, the 14th. He said, I was born the 7th, so I'm a week older. And then his wife says, yeah, but you look 20 years older, which he did. Now, I don't know this man. I don't know what his eating habits are, but I'll bet you they're completely different than mine. I've been vegetarian 45 years. I never smoked a cigarette. Don't drink alcohol. Don't drink coffee. Don't drink soda pop. Don't eat trans fats. Don't have any fun. Yes. No, that's what people say. How can it be fun to be healthy? I'll tell you, it's fun to be healthy, not to have pain. And to have energy and to look good and have people flatter you that you look pretty good. You know, you feel good. I got hair, I got teeth. My face is not all wrinkled up. So the thing is that aging is a direct result of you not eating the proper foods. It's not genetic. Okay, this genetic thing has been way overemphasized. Okay, they talk about cancer being genetic because maybe your parents and grandparents had the cancer. But we can look at statistics. We know 100 years ago, only 1% of the population got cancer. Now it's 50%. If it were genetics, it would still be 1%. There must be environmental factors, variables that we can change, like our lifestyle, our diet, etc., that may be impacting our health. How about these kids with all the autism? Autism was non-existent when I was a kid. Well, we didn't have vaccines when I was a kid. Now there's 81. They get more in one visit than I had my whole life. Where is all this coming from? I said people are consuming a ton of medications, which was not common when I was a kid. You know, people now very often are on 5, 10, 15 different medications. How many people are on at least one medication? Let's see, show of hands. Okay, and a couple of young people here. How many people are on at least 5 medications? Anyone doing 5? Well, then, 5 or more. Yes? No? You're on more than 5 medications? Well, I have a relative who's a medical doctor. He says if you're on more than 3 medications, you're over-medicated. Now, I'm not telling you to get off of them because, like in the case of steroids, could be dangerous. But you're just treating symptoms and you're creating new problems by interfering with the body's functioning. So, we have products that can provide nutrients like the HA+. We've had many people that were scheduled for knee and hip replacement surgery and we're able to avoid it by taking the HA+, rebuilding the cartilage. I know a lot of doctors will say impossible. There's no blood supply. That's wrong. There is blood supply to your cartilage. So if you have this bone on bone I was talking about, you can rebuild the cartilage. Now, healing is a process, not an event. This is not a drug that's masking over symptoms. It may take 3 or 4 months for you to notice improvement. I have a friend who's a doctor of chiropractic in North Hills. I'm not going to mention his name, but he used to be on radio. Some of you probably know who he is. And he called me up some years ago and said that he was scheduled for knee surgery. And he was going to do it over the Christmas holidays because he figured he could close the office for a few weeks. He's a solo practitioner because a lot of people go on vacation and it would be less downtime for his patients to not have them available. And I said, well, you have this sitting right on your shelf. It's called HA+. You think that'll help? I said, I know it'll help. So what happened was he started taking it. A month later, he called me up and he says, I don't know, I still have the same symptoms. I said, keep taking it. Healing's a process, not an event. He called me up after 2 months and said, I still have the same symptoms. I said, keep taking it. Healing's a process, not an event. He called me up 2 weeks later. He said, it's like overnight. He said, I don't have any pain anymore. I played basketball with my kids yesterday. The body was building up that cartilage, and then it got to a point where his symptoms abated. It's like building a skyscraper downtown. PNC built that big building with your TARP money, incidentally. They got a lot of money from the government, so they bought out National City Bank, and now they're building. So I used to pass by there every week going to the Symphony, and it didn't get to ground level for several months because they were building the foundation to hold that big building, and that's what your body's doing. So you may not have symptomatic relief right away. Everybody's different. But healing is a process, and your body can rebuild, and you can eat and grow younger. I talked about that this week. We've had people that improved their diet. They started growing their hair back. The bones started getting stronger. The teeth weren't loose anymore because the bone structure was getting stronger, holding their teeth. They had less aches and pains, lost weight. They started reversing the aging process because each succeeding generation of those new cells we're better than the one before instead of getting weaker. Okay, now we have a few minutes. I want to summarize. You may have misaligned vertebrae that affects the body functioning, including you may not have any pain, and that could be affecting the functioning of the body. You may have tight muscles causing pain. You may have food allergies. You may have nutritional deficiencies. We talked about, now the green lip muscle, we didn't mention. We ran out of stock this morning. If you want to get the green lip muscle, which is another great thing for arthritis pain, you can pay for it here, get the discounted price today, and then when it comes in, we can ship it out to you. You can pick it up. So I have about 5 minutes before I have to run off to the radio. Let's have a few questions. You don't have to limit yourself to arthritis and pain. Yes?
You mentioned something about elderberry syrup. What was that?
Yeah, we have this stuff called Sambucus that's very good for fighting colds and flus. We also have the oscillococcinum, which is excellent for flus. We have the Cold Calm fighting colds, Ester C+, Immunomax. These things ought to be at home. You could be taking them every day, or if you want to start, especially the homeopathic remedies like Oxilo and Cold Calm, you take it when you think you're having symptoms of cold or flu. But the Immunomax and the Ester C can build up your immunity. A lot of people getting the flu shots are getting very sick. We've seen a number of them already. Flu shots don't work. It actually increases your risk of getting the flu. Pneumonia shots, we had several bad calls the last couple of days. People got really sick from the pneumonia shot. I do not recommend it. Yes, Kathy?
Does D3 stay in the body?
Vitamin D3, yes, can be stored in the body. However, the doctors finally have discovered that people are very deficient in vitamin D3, especially in northern climates, and it is related to multiple sclerosis and decreased immunity and increased risk of cancer. We put all our cancer patients on vitamin D3, and the normal levels are between 80 and 100. And so a lot of people are down in the teens or 20s. They need to boost their vitamin D. But instead of giving you a huge amount, 50,000 units once a week like the doctors do, we'd recommend 5,000 or 10,000 units a day. And of course, we have that here. A couple other questions. Yes, ma'am.
Doctor, I went off of metformin.
Mhm.
I have diabetes,
Mhm.
and I went off of metformin, gabapentin,
Mhm.
and hydrochlorothiazide. I think that's how it's pronounced.
Mhm.
And I've been feeling so much better. I'm taking Frontier medicine.
You mean nutritional frontiers like the Sugar Solve and the Pro Oranges? We've had a lot of people that had very elevated sugar and were able to normalize it, improving their diet, staying away from wheat, taking the Sugar Solve and the Pro Oranges. That's wonderful. Now, let me tell you something about hydrochlorothiazide. That's a water pill,
Yes.
sometimes used for water, sometimes used for blood pressure. That causes diabetes.
That's right.
So she was on diabetic medication. And then the other thing is hydrochlorothiazide is very hard
Thank you.
on the kidneys. And metformin is very hard on the kidneys. So she was on metformin and hydrochlorothiazide, basically both ruining her kidneys, plus the HCTZ, the hydrochlorothiazide, can cause diabetes, as can cholesterol medication. Anyone here on cholesterol medication? Okay, well, you need to consider getting off of it. We do have the Cholesterol Care 2. And most people that have heart attacks have low cholesterol. Cholesterol is a necessary nutrient. You wouldn't be here without it. Your cell walls are made out of it. Your male and female hormones, and men and women have both, are made out of it. Your brain's 50% cholesterol. We have a whole packet over there about cholesterol that you need to get. And you should consider the Cholesterol Care 2. And are you on coenzyme Q10, sir? Because it's a requirement in Europe, but here they don't know that. But cholesterol is totally overrated as a risk factor for heart disease and stroke. Okay, one or two more questions. Yes, sir.
Arthritis, gout, diet.
Okay, gout is a form of arthritis that's usually caused by eating too much meat. So I cut down way back on the meat. And we do have a product called Gout, G-O-U-T, that can help with gout. So you go in there, it's called G-O-U-T. I don't think we put that on here. I mean, there wasn't space for everything. But we do have the G-O-U-T product, and you should cut down on the dead animals. In fact, studies show that if people get on a vegetarian diet, in most cases they get rid of their arthritis.
Cherry juice.
Well, we have the gout has the concentrated cherry and pantothenic acid. When you drink cherry juice, it's 90% water. So we have the tablets that have the cherry juice concentrate and the pantothenic acid. Very, very effective. It's called Gout, G-O-U-T, over there, Nutritional Frontiers, and you walk in on the right. Okay, one or two more questions. I got to run. Yes, ma'am.
This is a skin-related question. Sebaceous hyperplasia. Have you ever heard of
Oh,
that?
were you in here yesterday? Someone was in here and had that.
No.
Yeah, that, sebaceous hyperplasia. It's on the scalp.
No. Like the face, the oil glands. I guess it has something to do with the oil glands.
Well, first of all, yeah, sebaceous glands are oil glands. They're mainly in the scalp. I would recommend washing with the Miracle Truth soap we have there, the green liquid soap,
Okay.
and then take.
Again? I'm sorry.
It's called Miracle 2 Green Liquid Soap.
Okay.
It's a liquid soap there, okay? And the other thing is flax caps, F-L-A-X-C-A-P-S, flax caps.
Okay.
There's a pen right next to you. Why don't you just write this down on something? Yeah, write that down. It's called Miracle 2 soap. It's a liquid green soap we have over there. And you wash with that, and then the flax caps. And whoever has that problem needs to get off hydrogenated fats like margarine, Crisco, deep fried foods, commercial peanut butters. So flax, F-L-A-X caps, and the green Miracle 2 soap.
Okay. And could he use all natural peanut butter or?
Yeah, well, all natural, yeah, you have to get off the hydrogenated.
Hydrogenated stuff?
Right.
Okay.
Okay, I'm going to sign off because I have to run to the radio. We have excess copies of this literature. If you want to get some of it up here, you didn't get it, or you want to get some for a friend, keep in mind we have that literature rack by the food table with the cholesterol medication and a lot of other information, like information on the hazards of drugs. Thank you very much, and God bless you. Our phone number is 412-922-WELL or 412-922-9355. Our website, drweiner.com. Then remember us on Facebook and friend us on Facebook at James Weiner or Weiner Wellness Center. Thank you very much, and God bless.
Great talk, Todd.